Hello everyone, I'm Dr. Stephen Kane. I have a specialty in functional neurology. I'm the president and co-founder of the Whole Brain Health Initiative, and I'm the owner here at NeuroSolutions, a company dedicated to helping people with peripheral neuropathy, which is exactly what this video is about. We're going to talk about what peripheral neuropathy is, what causes it, and what can be done to successfully treat it. So first off, peripheral neuropathy is a condition that affects about 20 million people in this country alone. And it's a very vague term. All it means is that you have dysfunctioning of the nerves in your peripheral nervous system. Peripheral meaning anything besides your brain and your spinal cord. So this could be anything from burning, numbness, tingling, weakness, any dysfunction of the nerves in your body, and you have peripheral neuropathy, which is a dime a dozen type of diagnosis. It's not until you actually know the etiology or the cause of the peripheral neuropathy, then you are much more empowered to successfully manage and treat this condition. So what are the causes? Well, first off, there are mechanical lesions. This is some type of compressive force constricting down on the nerves in your peripheral nervous system. This could be anything from muscles that are tightening up and clamping down on the nerves. It could be that the joints perhaps in your spine are compressing down on the nerves that go down to your arms, legs, hands, feet. Now, as a chiropractor, I have seen hundreds of these cases, and the great thing about them is that the vast majority of them get significantly, if not completely, better. The second cause is metabolic. This could be anything from diabetes to vitamin deficiency or toxicities, heavy metals, chemicals, chemotherapy drugs, cancer, infections, autoimmune dysfunction, so many different types of metabolic causes of peripheral neuropathy. Again, great thing about these is that most of these are highly treatable when you successfully address the cause of their metabolic condition. The third category is genetic. Now, the unfortunate thing about genetic-mediated neuropathies is they are much tougher to treat than most of people in the other two categories. There's still plenty of things that can be done to help manage these conditions and make the best of them, but the prognosis just tends not to be as well. Now, when it comes to treatment, first and foremost, what is the cause? Is there a mechanical lesion that you can reduce that compression on the nerve? Are there metabolic components where by addressing the diet or the lifestyle that you can improve upon this? That first and foremost is how to address peripheral neuropathy. There are way too many people in this world that are simply taking a pain medication to mask their discomfort without truly getting at the cause. That's one of the reasons why I started up this company, because there's very much a need for this. Now, once you've done that, once you've successfully addressed the cause that will commonly prevent things from getting worse, but it normally won't return the person back to optimal functioning. In addition, the person needs to repair their vasculature. Most people with peripheral neuropathy, these blood vessels that provide nutrition to the nerves become compromised, and when you do things like aerobic exercise, you create more of these blood vessels so that you're now sending more nutrition to the nerves and you're getting the waste products out more efficiently. There's also various therapeutic approaches and dietary approaches to helping these blood vessels dilate or open up so that you can now shoot in more of the nutrition and get the waste products out more efficiently. The third component is retraining the nerves. Most people that have peripheral neuropathy have had it for quite some time, and their nerves have become habituated, or they've become wired to send these painful, uncomfortable signals up to the brain. When these nerves become rewired to send these healthier signals, they now have a much better connection between their body and the brain that is no longer mediated by pain. Plenty of ways to do this. There's vibration therapy, there's electrical stimulation, soft touch, deep touch. There's so many different ways to activate the nerves in the body to restore this healthy connection with the brain. It's all about finding the right recipe based off the individual and where they're at. Now, the last component is musculoskeletal rehabilitation. Most people with peripheral neuropathy have not been as active as they ought to be because of the discomfort that they're in. This leads to a couple things. One, the joints in their body. This is a foot, but you can apply the same concept anywhere else in the body. The joints get stuck in their body. They're not moving the way that they should be moving. So reinstating the proper biomechanics of the skeletal system will allow for proper movement patterns, and re-strengthening the muscles that have become broken down and restoring balance. All of this will allow a person to safely return to doing the activities that they enjoy doing. Now next up, I'm going to talk about why it's important for those of you with peripheral neuropathy to take action as soon as possible. First off, you all know more than anyone else that chronic pain is a terrible thing to have to endure. Most of you do not need to be in the amount of pain that you're in. The second reason is that the longer that you wait, the more this degeneration to the nerve sets in, and the harder it is to reverse a condition and return a person back to optimal functioning. And the last point is that the longer you wait, the greater the risk that something serious might happen, such as an infection or worst case scenario, an amputation. Most of you with peripheral neuropathy watching right now can get so much better by following through with this approach that I've described in this video. I strongly encourage you to take us up on the free consultations that we provide so that we can help point you in the right direction. We can help you figure out what is causing your peripheral neuropathy. We can help you figure out what are going to be the best forms of treatment for you as an individual. Whether you're local to the Palo Alto area or not, we can still work with you remotely. So do not hesitate. Reach out to us as soon as possible and allow us to help you get yourself one step closer to leading the life that you want to and you deserve to have.